everybody. Today I'm going to be talking a little bit about upper cervical chiropractic care. So, when we talk about upper cervical chiropractic care, a lot of times people don't quite understand what it is, why we do it that way. Somebody could be coming in for a lot of different things. It could be headaches, migraines, which adjusting the upper neck would make sense. But we also use it for somebody who's coming in with things like low back pain, chronic sciatica, chronic fatigue syndrome, anything along those lines. But why would we adjust the upper neck for a lower back issue is a lot of times what people will ask me. Well, let's think about this for a moment. The signals from the brain have to travel through the neck to get to the rest of the body. If the very upper joints in the neck, so the axis, which is the second bone down and looks like this, and the atlas, which is the top bone and sits right above it like that, if those two bones are not moving correctly, if they're shifted one on top of the other, like this, like this, like this, that is going to affect the signals from the brain down to the rest of the body. Well, obviously, if the signals are affected, the body's not going to move correctly. If the signals that go to the muscles in the low back are not getting there correctly, that muscle may tighten for no reason. If it's tightening for no reason and we're starting to adjust the lower back, yeah, it might release temporarily, but it's going to come back, and it's going to continue to come back until those signals from the brain to that muscle have sorted themselves out. So it may not be necessarily the muscles that are tightening. It could just be the nerve into the leg is being irritated because the signal from the brain is not getting there properly. So unless we make sure that that upper neck is moving the way that it's supposed to, that problem is never going to go away. There are so many times I've had people come into my office. They've been to other chiropractors. They've even been to me in the past before I started to work on the upper neck more specifically, where they'd come in, they'd get adjusted, they'd feel great for a week or two, and then it comes right back, and the problem never really goes away. And I may, or the other chiropractor may have sent them and said, oh, you need to strengthen your core muscles, and they go away and they try that, and it doesn't really make a difference. What we find is when we do make sure that those signals from the brain to the rest of the body are getting there the way they're supposed to, and the muscles have a chance to actually behave the way it's supposed to, those adjustments last much longer. They're not finding that they get adjusted and it's coming back in 2 weeks or 3 weeks. So that is essentially the basis of upper chiropractic cervical care, is to make sure that those signals from the brain can flow down through those upper two joints in the neck and get to the areas that they're supposed to the way they're supposed to. It just allows the body to function that much better. When we talk about upper cervical care, there is a lot of different techniques out there. Just as in chiropractic, there's a lot of techniques in general. Some techniques will work better for some people than other techniques. The more common upper cervical techniques that we see out there are techniques such as Blair technique, which is the one that I use, Gonstead, Nuka, Atlas orthogonal, lots of different ones. The key is they're all focusing on that upper neck. Personally, I find that the Blair technique fits with my philosophy, the way that I feel that things move. It's just talks about how these specific bones, as well as the skull, are shaped slightly different in everybody. They're not going to be real across the board the same. So not everybody is going to look like these plastic models. So these surfaces here that connect these joints may be deeper on one person, shallower on somebody else. You can have on the same person, one side deep and one side shallow. The angle of them may be different. Even on the same person, you can have one angled really, a very small angle or a very hot, big angle. That's going to change the way that we need to adjust. So in Blair technique, we use a lot of different kind of diagnostic things to see what is going on. Do we need to change the way that we're adjusting you because you've got a deeper angle or a deeper edge to the joint? So we take either a series of x-rays, or we can do something called a cone beam CT, which will show me a 3D image of your specific spine, of what's going on with your particular neck, so that I can actually make the right adjustment so that you have a better lasting adjustment. The other nice thing about Blair is it's actually a fairly gentle technique. We're not taking the head and rotating it. A lot of people come in and they say they don't mind the cracking noise of the adjustment. They don't like their head being put into very awkward positions and having it yanked on. So with Blair technique, we don't do that. We actually have you just lie on your side, and it's a very gentle, just push. And it is much more comfortable for people. A lot of times I've had people say, have you even done anything? And it's like, yeah, I've done something. You'll notice a difference. It's, again, a very specific technique that I find just works really, really well. A wonderful just website that you can go on to learn a bit more about Blair technique. You can go onto my website. I've got some information on that. So www.roadtowellness.co.nz, or you can actually go to the Blair Society's website. So that is www.blairtechnique.com. And they have a lot of information up there as well. So that is a little bit about upper cervical chiropractic and the Blair technique itself and why I use it. So again, I use it so that we can get those signals going properly to the rest of the body. And then if it hasn't cleared everything out, then there are all those other wonderful techniques that we can use to help clear out that little bit of leftover stuff that's going on. So that's it from me today. Again, my goal is to help you get back to living the life you love and doing the things you love. Feel free to contact me at any point. Bye.